Did we ever encounter a worse pandemic than COVID-19? Did the Spanish flu originated in Spain? What was the number one pandemic in human history? Welcome to MrBug, and today we answer these questions and talk about disease outbreaks that have ravaged humanity, sometimes changing the course of history and at times signaling the end of entire civilizations. Here are 5 of the worst pandemics next to the new coronavirus pandemic, which date from the ancient to modern times. Number 6. COVID-19. Coronavirus disease 2019 is an infectious disease caused by severe acute respiratory syndrome coronavirus 2. The disease was first identified in December of 2019 in Wuhan, the capital of China's Hubei province, and has since spread globally, resulting in the ongoing 2019-2020 coronavirus pandemic. While the majority of cases result in mild symptoms, some progress to viral pneumonia and multi-organ failure. If you want to find out more about coronavirus, you can click on the information card or use the link in description to another video about how dangerous the new coronavirus is. Number 5. HIV/AIDS. HIV/AIDS, or human immunodeficiency virus, is considered by many a global pandemic. As of 2018, approximately 37.9 million people are infected with HIV globally, 770,000 dying from the disease in 2018. The 2015 Global Burden of Disease study estimated that the global incidence of HIV infection peaked in 1997 at 3.3 million per year. Global incidence fell rapidly from 1997 to 2005 to about 2.6 million per year, but remained stable from 2005 to 2015. Scientists identified a type of chimpanzee in Central Africa as the source of HIV infections in humans. They believe that chimpanzee version of the immunodeficiency virus most likely was transmitted to humans and mutated into HIV when humans hunted these chimpanzees for meat and came into contact with their infected blood. Over decades, the virus slowly spread across Africa and later into other parts of the world. Some countries are more affected than others, and even at the country level, there are wide variations in infection levels between different areas, Sub-Saharan Africa being by far the worst affected region. No effective cure currently exists for HIV. But with proper medical care, HIV can be controlled. Treatment for HIV is called antiretroviral therapy, or ART. If people with HIV take ART as prescribed, their viral load, amount of HIV in their blood, can become undetectable. Before the introduction of ART in mid-1990s, people with HIV could progress to AIDS, the last stage of HIV infection, in a few years. Today, someone diagnosed with HIV and treated before the disease is far advanced can live nearly as long as someone who does not have HIV. Number 4. Plague of Justinian. The Justinian plague struck in the 6th century and is estimated to have killed between 30 and 50 million people, about half the world's population at the time, as it spread across Asia, North Africa, Arabia, and Europe. The pandemic afflicted the Byzantine Eastern Roman Empire, and especially its capital, Constantinople, and port cities around the entire Mediterranean Sea, as merchant ships harbored rats that carried fleas infected with plague. The plague returned periodically until the 8th century. The waves of disease had a major effect on the subsequent course of European history. Modern historians named this plague incident after Justinian I, who was emperor at the time of the initial outbreak. Justinian himself contracted the disease but survived. The number of deaths is uncertain. Some modern scholars believe that the plague killed up to 5,000 people per day in Constantinople at the peak of the pandemic. According to one view, the initial plague ultimately killed perhaps 40% of the city's inhabitants and caused the death of up to a quarter of the human population of the Eastern Mediterranean. Number 3. Spanish flu. The Spanish flu, also known as 1918 flu pandemic, was an unusually deadly influenza pandemic. Lasting from January 1918 to December 1920, it infected 500 million people, about a quarter of the world's population at the time. The death toll is estimated to have been anywhere from 17 million to 50 million and possibly as high as 100 million, making it one of the deadliest pandemics in human history. To maintain morale, World War I censors minimized early reports of illness and mortality in Germany, the United Kingdom, France, and the United States. Newspapers were free to report the epidemic's effects in neutral Spain, such as the grave illness of King Alfonso XIII. And these stories created a false impression of Spain as especially hard hit. This gave rise to the name Spanish flu. Despite its popular name, historical and epidemiological data cannot identify the geographic origin of the Spanish flu, and it was definitely not Spain, the influenza pandemic spreading in Spain from France in November 1918. While the global pandemic lasted for 2 years, the vast majority of deaths were packed into 3 especially cruel months in the fall of 1918. Historians now believe that the fatal severity of the Spanish flu's second wave was caused by a mutated virus spread by wartime troop movements. Modern analysis has shown the virus to be particularly deadly because it triggers an overreaction of the body's immune system, which ravages the stronger immune system of young adults, whereas the weaker immune reactions of children and middle-aged adults resulted in fewer deaths amongst those groups. This could be the case, however, malnourishment, overcrowded medical camps and hospitals, and poor hygiene promoted bacterial superinfection. This superinfection killed most of the victims, typically after a somewhat prolonged deathbed. Number 2. Smallpox. The earliest credible evidence of smallpox is found in the Egyptian mummies of people who died some 3,000 years ago. Smallpox has had a major impact on world history, not least because indigenous populations of regions where smallpox was not native, such as the Americas and Australia, were rapidly decimated and weakened by smallpox, along with other introduced diseases, during periods of initial foreign contact, which helped pave the way for conquest and colonization. On average, 3 out of every 10 people who got it died. During the 18th century, the disease killed an estimated 400,000 Europeans each year, including 5 reigning monarchs, and was responsible for a third of all blindness. One of the first methods for controlling the spread of smallpox was the use of variolation. Named after the virus that causes smallpox, variola virus, variolation is the process by which material from smallpox source was given to people who had never had smallpox. With variolation, people usually went on to develop the symptoms associated with smallpox, such as fever and rash. However, fewer people died from variolation than if they had acquired smallpox naturally. During the 20th century, it is estimated that smallpox was responsible for 300 to 500 million deaths. In the early 1950s, an estimated 50 million cases of smallpox occurred in the world each year. After successful vaccination campaigns throughout the 19th and 20th century, the World Health Organization certified the global eradication of smallpox in December 1979. There are now only 2 locations where variola virus is officially stored and handled under WHO supervision: the Centers for Disease Control and Prevention in Atlanta, Georgia, and the State Research Center of Virology and Biotechnology Vector Institute in Kosovo, Russia. Before we continue, be sure to subscribe to our channel and ring the bell to be notified about our latest videos. Number 1. The Black Death. The Black Death, also known as pestilence and the plague, was the most fatal pandemic recorded in human history, resulting in the deaths of up to 75 to 200 million people in Eurasia and North Africa, peaking in Europe from 1347 to 1351. The disease was caused by the bacterium Yersinia pestis, just like the plague of Justinian, and was the second plague pandemic recorded. The plague created religious, social, and economic disorder with profound effects on the course of European history. The Black Death probably originated in Central Asia or East Asia, from where it traveled along the Silk Road, reaching Crimea by 1347. From there, it was carried by fleas, living on the black rats that travel on Genoa's merchant ships, spreading throughout the Mediterranean basin and reaching Africa, Western Asia, and the rest of Europe via Constantinople, Sicily, and the Italian peninsula. In a panic, healthy people did all they could to avoid the sick. Doctors refused to see patients, priests refused to administer last rites, and shopkeepers closed their stores. Many people fled the cities for the countryside, but even there, they could not escape the disease. It affected cows, sheep, goats, pigs, and chickens, as well as people. In fact, so many sheep died that one of the consequences of the Black Death was a European wool shortage. And many people, desperate to save themselves, even abandoned their sick and dying loved ones. The Black Death is estimated to have killed between 30 and 60% of Europe's population. In total, the plague may have reduced the world's population from an estimated 475 million to 350 to 375 million in the 14th century. It took 200 years for Europe's population to recover to its previous level. The Black Death epidemic had run its course by the early 1350s, but the plague reappeared every few generations for centuries. Modern sanitation and public health practices have greatly mitigated the impact of disease, but have not eliminated it. While antibiotics are available to treat the Black Death, according to the World Health Organization, there are still between 1,000 to 3,000 cases of plague every year. Did you know about these pandemics? Is there anything we might have missed? Write your thoughts in the comments. If you have questions or ideas on what we should talk next, please write them also. And while you're there, don't forget to subscribe. Thanks for watching and stay safe.